Well, I'm back. So I wanted to make this video because this is an interesting and funny topic. So the CDC released the cities with the highest STD rates. So this was in January 21st of this year. So this was just like a month and a half ago. So I'm gonna I'm gonna go through the article, then I'm gonna bring up why I'm making this video and why this video is important. So these is the cities with the highest STD rates. As you see, San Francisco, Baton Rouge, New Orleans, Montgomery, Alabama, Jackson, Mississippi, Memphis, Tennessee, St. Louis, Philadelphia, Washington, D.C., and my city is on here, Detroit, which is funny. So, said for our seventh annual study of STD rates based on the latest data published by the Centers of Disease Control and Prevention, Interbody Research analyzed statistics on a city-by-city basis and developed our list of top 100 cities with the highest STD rates. In this year's report, the city with the highest STD rate was Philadelphia, overtaking Memphis, Tennessee, which moved to second. This in turn pushed Mississippi, Mississippi from second to third in our ratings. In addition to ranking the 100 cities with the highest STD rates below, we'll provide some takeaways from our report. Spotlight cities whose STD rates have significantly improved or declined, highlight racial disparities that emerge from the CDC data, scrutinize a notable omission in data, and explore why this year's data is somewhat unique from recent years' study. So the South continues to suffer, but even more so relative to other regions of the country. So basically, the South out of all regions has the highest STD rates, which makes sense because the South, I'm sorry, y'all know for every like y'all a lot of negative stuff come from the South. I'm sorry if you from the South, but it just does. Like the warm weather, I don't know what it is, but we know how messed up Florida is and all the crazy stuff that happens in Florida. And the South is where slavery was mainly at, and stem from the South has always been the South. But it also say this is the first post-lockdown STD data that the CDC has released in the COVID era, and it isn't reassuring. Syphilis rates are on a disturbing and deadly rise with tragic consequences for newborns. Mm. Where's the STD case data from the Baltimore MD metropolitan area? So where is the STD case data? Want to settle in a city with consistently low STD infection rates relative to other urban areas? Our study would suggest Provo, Utah. Yeah, UT, I believe is Utah. So I guess that's the urban city with the least amount of STD cases. Notable movement or lack thereof in our rankings. Last year, our study found that Philadelphia was suffering from the fifth worst STD infection rates among U.S. metro areas. Even so, it rates worsened relative to other cities in this year's study. As a result, it now leads all major metropolitan areas with the highest infection rates. So last year they was fifth, and then they jumped to number one in a year's time. So that's crazy. Meanwhile, on the West Coast, as San Francisco, California has faced its share of well-documented challenges, it has experienced a decline in our rankings assessment as well. In our previous study a year ago, available CDC data led the city to improve by 3 ranks. Yet this year diminished, it deteriorated from 15 to 8, leapfrogging metropolitan areas like the District of Columbia, Little Rock, Arkansas, and Norfolk, Virginia, which moved very little. There's one city that hasn't moved much in our ratings, but in a positive way. Coming in coming in at 99th last year, Provo, Utah. Narrowly improved on its relatively stellar standing to secure 100 this year, the best among the 100 metro areas in our study. Southern cities face challenges. In past years, we made the worrisome observation that the South has defined by the Census Bureau, contributes a disproportionate number of metro areas to the upper portions of our ratings. In our annual study, last year, for instance, 14 of the 25 U.S. cities with the highest STD infection rates were in the South. That means a region with roughly 39% of our nation's population contributes over half of the 25 cities with the worst STD infection rates. But this year, the number of southern states has risen to 17 out of 25. So 17 out of the top 25 cities with the most STDs is in the South, or just 2/3. This overrepresentation in our study is disturbing. 2 of last year's top 5 cities find themselves in nearly the same inevitable position in our latest study. Memphis, Tennessee was first, now they second, and Jackson, Memphis, Tennessee was first and now second, and Jackson, Mississippi was second and now third. One capital city, however, appears to be bucking this trend. Columbia, South Carolina, which ranked third highest in our study last year, but has since improved to 21st this year. So South Columbia, South Carolina, they went from third all the way down to 21st. So y'all still in the top 25, but that's a big, that's a big leap in the right direction. Charlotte, North Carolina has also improved dramatically in our ratings. In our prior study, it had the 13th worst STD infection rates, but that rating improved to 28th this year. So Charlotte, North Carolina went from 13th to 28th. Chlamydia and gonorrhea on the rise as syphilis surges. New cases of gonorrhea, over 710,000 of them, and chlamydia, over 1.6 million, signaled the CDC that chlamydia rates has risen back to pre-2020 levels, with gonorrhea rates continue to increase across our cities. Unlike chlamydia, confirmed cases of gonorrhea never slowed in 2020. Meanwhile, syphilis rates have risen by a massive 28.6% since the last study. But the rise in the congenital syphilis rate naturally is even more staggering, 30.5%, constituting a tenfold increase in newborn syphilis cases over the span of a decade. These numbers mean that since 2001, syphilis cases in our nation have increased 781%. Cases of congenital syphilis during that 20-year span has risen by 464%. So since 2001, syphilis has increased by 781%. That's crazy. And then congenital syphilis rose by 464% over the 20-year span. So that's a huge increase over the last 20 years. Tragically, there were 220 cases of stillbirth or infant death in the U.S. due to the disease over the course of the most recent year, for which the CDC provides this data. The thousands of infants who survive face lifelong health issues due to the infection. So that's very important to point out. Basically, people is getting these STDs and passing it on to their babies. Like, if you didn't know, because I forgot who said this, but like some babies are born blind because of the STD. So, and some don't even make it. So a lot of people who get syphilis and is it just syphilis, but the STDs I don't know if it just but syphilis is one of them. It's causing them to be born blind and deal with other health issues. So not only is people catching STDs, they also passing it on to their children or it causing babies to die, babies to go blind, babies to have health issues. So that's big and that's messed up. So 220 um babies died from the disease or catching, from somebody from their mother, obviously having the STD. Every city and state is feeling the effects of the surge and syphilis, but communities in California, Texas, Florida, Arizona, and Louisiana feel it more profoundly. At this time, those five states collectively account for nearly 60% of reported cases. So 60% of all the cases of syphilis is in them 1, 2, 3, 4, 5 states. Social and racial disparities. So this is important. Though growing infection rates affect nearly all communities, the STD burden within our cities hits minority, racial, and ethnic groups the hardest. When comparing infection rates of white people to those of some minority, racial, and ethnic groups, the CDC data shows the dramatic disparities remain. So basically, we know African Americans, or it could be African American and even or hold on, let me read this because this. No, I don't. So basically, say African Americans and even maybe Latinos, Mexicans, maybe Asians, but we know Asians probably a small percentage. But we sad to say, as an African American, we know that because if you get into the cities, which I'm gonna look at, it's mostly heavily populated African American cities, and some might be like Latino also, but basically. Um, African Americans is hit the hardest by these STD rates. Alaska Native or American Indian people account for only 0.7 of live births during this year of the study. Yet those newborns account for nearly 4% of the syphilis cases. So Alaska Natives and American Indian people, y'all only gave birth to 0.7% last year, but 4% has syphilis cases. So that means that a lot of y'all births is, y'all having a lot of y'all births is resulting in syphilis cases. So a lot of Alaska Natives and American Indian people, despite not having a lot of children, the children that they do have, a higher percent is being reported having syphilis cases. Meanwhile, non-Hispanic Black people make up 12% of the U.S. population, but suffer 31% of the cases of chlamydia, gonorrhea, and primary and secondary syphilis. So, non-Hispanic Black people, so basically African Americans who make up 12% of the population suffer from 31% of chlamydia, gonorrhea, and syphilis cases. So 12% of the population, but 31% of the STD cases. Health leaders stress that differences in sexual behavior aren't the explanation for these differences in rates of infection. What can spell the difference between life and death or illness and health are timely testing and treatment. So that's what it is big too in the African American community. A lot of us don't get tested. A lot of us don't, get tested for STDs. A lot of us don't go to the doctor. So that's why that's a big reason also. So it's not to say that African Americans are sleeping around more than white people or other races of people, but it is showing that we get tested the least. But it has to be both. Nearly 90% of these cases of newborn syphilis were preventable through testing and treatment during pregnancy. So y'all not even getting tested during pregnancy, which is crazy. Barriers to timely testing and treatment include lack of health insurance, poverty, and housing issues, substance use disorder, and lack of significant public health infrastructure. All of these factors continue to affect minority, racial, and ethnic groups disproportionately. So basically, they're saying that lack of health insurance, a lot of African Americans don't have health insurance or living in poverty or have housing issues is the reason why a lot of y'all are not getting tested. While newborn syphilis cases are increasing nationwide and across every racial and ethnic group, some communities, including those of people who are Black, Hispanic, and American Indian or Alaskan Natives, are experiencing the burnt of the newborn syphilis epidemic, says Laura Bachman, MD, MPH, FIDSA, FACPH, the Chief Medical Officer in the CDC's Division of STD Prevention. Effects of the pandemic on STD infection, worrisome and not fully revealed. When the CDC examined data from 2020, a couple years ago, it had been significantly impacted by socially disruptive lockdowns. And yet, nonetheless, infection rates rose year over year. In other words, we were not socializing more, yet we were spreading STDs at a higher rate. So even during COVID, when it was a lockdown, STD rates was still up and people were still sleeping around and catching STDs. This trend only underscores what CDC officials have said about the vital importance of public health infrastructure to the prevention of spread of STDs. It's not enough that we see one another less. Reliable and relatively easy access to testing and treatment for STDs is of paramount importance if our goal is to lower STDs. So basically, if people got tested more, it wouldn't be as high. While the socially disrupted year 2020 still produced increases in STD infection rates compared to the year prior, the latest CDC data shows that what followed yield infection rates that were worse still. 2021 was unaffected by various lockdowns or shelter-in-place mandates, yet public health infrastructure remains significantly frayed and has yet to recover. Effectively, what has happened is that normal patterns of life return, but without the easy ability to access sexual health testing and subsequent treatment. For these reasons, with such disruption to routine community healthcare access, the CDC anticipates that its latest data upon which this study relies likely underreports infection counts and underestimates infection rates. So they basically saying that this is even underreported because a lot of y'all are not getting tested. So the rate in cases is probably even higher because a lot of people not even still getting tested. So it's a lot of cases that they don't know. So the top 25 cities with the highest STD rates. So like they said, it's Philadelphia is number one with 15,000 chlamydia cases last year, 1,100 syphilis cases, 618 HIV cases, 10,854 gonorrhea cases. Memphis, Tennessee was second with 9,000 chlamydia cases, 300 syphilis cases, 300 HIV cases, and 5,000 gonorrhea cases. So if you look at this, like Philly even doubled number two. So they got double the HIV cases, double the gonorrhea cases. That's like triple the syphilis cases, and then a little bit less than double chlamydia cases. So Philly, y'all hands down number one. I don't know what's going on in Philly, but it's crazy. Jackson, Mississippi, chlamydia is 4,000, almost 5,000 cases of chlamydia. Syphilis cases is 81. HIV cases is 69. Gonorrhea cases is 19,000. New Orleans is number 4. Chlamydia cases is 9,000. Syphilis cases is 4,000. HIV cases is 271. Gonorrhea cases is 4,239. St. Louis is number 5 with 7,843 chlamydia cases, 470 syphilis cases, 308 HIV cases, and 4,118 gonorrhea cases. Baton Rouge, Louisiana, Chlamydia, 6,360 cases. Syphilis is 182. HIV cases is 170. And gonorrhea cases is 3,312. Montgomery, Alabama, 3,252 cases. Syphilis cases is 80. HIV cases is 64. Gonorrhea is 1,571. San Francisco, Cali. Chlamydia is 9,392. Syphilis cases is 496. HIV cases is 245. And gonorrhea cases is 6,500. So how is Alabama ranked over Cali when Cali got more chlamydia, syphilis, HIV, and gonorrhea cases? But I guess they're probably by population. Well, they say STD cases per 100K is 13 versus 12. So I don't know how shouldn't San Francisco be over Alabama or Montgomery? Maybe it's something I'm missing. So then it's Detroit. Detroit, them HIV cases is crazy. 408 HIV cases, 7,000 gonorrhea cases, 675 syphilis cases, and 8,000 chlamydia cases. So that's a high number. Detroit, y'all tripping. And this is why I can't be messing with no females from Detroit. I got to mess with some females from the burbs. I'm sorry. I can't do it. Washington, D.C., the state capital, is number 10 with 14,000 chlamydia cases, 491 syphilis cases, 764 HIV cases, which is crazy, and 6,900 gonorrhea cases. So that's the top 10. I'm tired of reading, but I'll just quickly go through them. I ain't gonna break down the numbers. Y'all can see the numbers. So Little Rock, Arkansas is number 11. Newport, Virginia is number 12. Portland, Oregon is number 13. Mobile, Alabama is 14. Cleveland, Ohio is 15. Miami, which you would think is higher, all the crazy stuff that goes on in Miami, but it's only 16. But them HIV cases is high. When you look at like all these other ones, like it got higher STD cases than everywhere. Yeah, because the highest was Philly was 618. Miami got 937 HIV cases last year. So y'all got HIV more than anybody. So be careful in Miami. Minneapolis, Minnesota is 17. Laredo, Texas is 18. San Antonio, Texas is 19. Milwaukee, Wisconsin is 20th. Columbia, South Carolina is 21. Richmond, Virginia is 22. Fort Lauderdale, Florida is 23. Lexington, Kentucky is 24th. And Augusta, Georgia is 25th. And then Tampa was 26. So that's the rest of the 100. So yeah, so the best places out of the 100 is in Utah or Santa Barbara, California, Colorado, New Jersey. Pittsburgh is surprisingly low. Well, not surprisingly, but it is, but then it's not. Albany, New York, Ventura, California. Like these are some of the lowest places with the lowest STD rates. One very noticeable case of missing data is Baltimore. It's been widely reported that STD infection rates in Baltimore were among the highest in the country in recent years. And our most recent study that was released last year, data indicated that Baltimore had one of the worst overall STD infections. It was fourth last year. To help reduce the spread of STIs in Maryland in 2022, the CDC dedicated $8 million in funds, with a close to $1 million of it going directly to Baltimore. Unfortunately, it appears that county health officials in Maryland did not disclose data about infection rates for CDC's latest annual report. So basically, Baltimore chose to keep theirs under wraps. So I don't know. I mean that's probably that signals something bad because if it was good, why would they not want to report it? So they basically probably gave them all that money and they probably still out there catching STDs. So yeah. Minister says proposed actions to improve the national outlook. So partner with pharmacies and clinics to increase easy local access to STD testing and treatment. Establish express clinics where people can access walk-in testing and treatment without full exams. Harness the potential of telehealth, telemedicine as a convenient method of testing um, for people across the country, including in rural areas. If you live in such area, are uncomfortable talking with your doctor or just can't find the time to get tested, an increasingly popular option is to take an at-home STD test. So basically, we already know, like they said before, the biggest prevention is to get tested and, of course, stop sleeping with people unprotected that you don't know and sleeping with multiple people. We obviously know that that's the solution. How did we collect this data? All of the STD data found in our report, including cases statistics for HIV, syphilis, gonorrhea, and chlamydia are from the CDC's latest data release. Syphilis data includes only primary and secondary syphilis cases and does not include congenital and early latent syphilis cases. HIV cases are not reported in some cities. Statistics for other relatively common STDs such as herpes are not collected by the CDC at this time and hence are left out of our analysis. For more information about statistics the CDC does and does not track, see its STD data and statistics page. All estimated metro area and state population data is from the CDC and U.S. Census Bureau. Though Washington, D.C. is technically a district, we chose to include it as a city. No statistical testing was used during the production of this research. So obviously they got this data from the CDC. So yeah, that's it. My takeaway from this. Obviously, my takeaway is what I already know is that STDs is affecting the African American and the minority communities the most. Like we suffering the most from this. So, we need to get tested more because that's what it really is. Like, y'all need to stop being scared to get tested. Like if you not scared to sleep around with multiple people and sleep with people unprotected, you shouldn't be scared to get tested. Like people need to get tested more. And and it's the culture, like, all of this over sexualized culture, the rap music, all of these female rappers bragging about sex and all of this is like, it's all contributing to it. We in an over sexualized society, especially in the Black community. So y'all need to look out for this. Like the cases is going on the rise year by year. And like I said, babies is dying from this. Babies is suffering health issues from this. Like, like we gotta really get on top of this. Go get tested, people, and like all of this, sleeping around and all of this crazy stuff, like it need to change for real. Like, we need to really do better as people. And then especially in the South, like, the South, y'all get a bad rep, but like y'all gotta be, more smarter for real and get out of this over sexualized, environment and all of this, way of thinking for real, because it's really hurting. Because like I know chlamydia and syphilis, I think it's curable, but like HIV not, and then it's just like who wants to catch an STD and have to be on medication for weeks, and it's embarrassing. That's why people don't get tested, because it's embarrassing. But that's the life you want to live. You want to sleep around and do all of that. This is the results of it. So that's why I made this video, because I make a lot of videos for educational purposes. So this is education for you. And then if you live in these cities, like if you live in Philly, you got to be careful about who you sleeping with, men and women. Just like I said, for Detroit, we #9. Like, I ain't messing with a lot of Detroit females. I need to see your STD, results. If you in one of these top 10 cities, you need to ask for them STD results for real. Unless you really know the woman or the man or whatever, and you really know them. Because people sleeping around, cheating, it's easier to cheat now more than ever. Like, this is what goes along with it. So, yeah, I just wanted to drop this knowledge for y'all. Go get tested. That's all I got to say. And we need to get out of this over-sexualized society, especially in the Black community.